Again, good afternoon, everybody. I can't stay for long because I have a flu, but I'm going to try to be brief and let the Imam would speak a few more on behalf of NHRC, and we have the UNICEF director, we have representative Dr. Diba, who will speak briefly on behalf of health, and Mr. Fafa Cham on behalf of Action Aid. But definitely, as the commissioner in charge of mental health rights within the commission, this has been a journey. And the journey started about 4 years ago when the institution visited Tanka Tanka. And I said to myself, I was with the African Commission when they passed the ruling on Purohit case, which had asked the government to rehabilitate then Kampama. And so when I walked into Tanka Tanka, I wasn't happy. None of us were happy, the whole group. So we embarked on that journey, and today we are here after the advisory note. I will call this a celebration in the sense that it has brought a lot diverse people across the sectors, from government to NGOs, where we can sit and openly talk about mental health, a topic that is a taboo in homes, a taboo in offices. Nobody wants to accept the fact that you have a child that has mental illness, or a father or a mother. So if we don't bring it out to the public and show them that it's nothing to be ashamed of, mental health, and it has come out here, it's not just the man walking in the streets naked. It's the employee in the office who is afraid at times waking up in the morning to go to the office, maybe because you have a boss that you cannot work with, or a patient. The other day we had somebody from the hospital, the EFAC, talking about the lack of basic facilities they need to work. That in itself can disturb somebody. Or you're in an office where you don't have proper table or ventilation. You go to some offices in government quarters, you're in a little cubicle with a desk, just a desk. You imagine, there are so many things we can talk about. Or some schools for our children, no windows, open windows. I remember once we went to the provinces, they said when it's very hot, you know what snakes are like. If it's a thatch roof, they fall into the class, everybody runs out. These are things that maybe they have changed. I don't know much, but these are issues we should all grapple with. If you have a family member, it has to start from the home. I always say it. Mental health doesn't come overnight. Even the guy who takes kush, you don't take kush today and go mad tomorrow. So you have to check your child. You have to check your brother. Let's check each other. Let's look out for each other. Our society, we tend to, I don't know what word to use. We tend to want to make it, when it's mental health, we want to hide it away from people when we know the problem is there. I had the traditional healers talk about the fact that, yes, we should leave the European way and use the traditional way. But is the traditional way, do you have to tie the individual up? We had a case recently where the individual was tied to a tree for days. There are ways we can treat. You don't have to tie the patient. Somebody talked about Tanka Tanka, closing Tanka Tanka. Tanka Tanka is not supposed to be a place. It's not supposed to be a cage. It's supposed to be like other institutions where you go there to be healed. But you can only be healed if you have qualified personnel. The day we walked into Tanka Tanka, I will say it here, we found them beating somebody that because she's very troublesome. You have a patient. There are ways, if you're qualified, you should be able to deal with any mental patient. I am standing here. There are days when I wake up and I ask myself, should I be in Tanka Tanka or should I be here? Because within a day, you can change from blue to green to yellow, depending on the environment. We all have kids. Some of us have children. Where they come, we want them to be better people. It's a psychological trauma you have to live with. So as we grapple with this, as we go home, I just want to urge, but before I also finish, and Imam will say a few words, I want to thank those who helped us get this far. And I will start with Action Aid. As soon as we sent out the notice that we wanted to do this conversion, Action Aid did not waste time. In fact, they funded this convergence 3/4 of the way. Then after, so let's clap for Action Aid. And then we had UNICEF came on board as well and funded us. And clap for UNICEF. And also UNICEF, WHO, Dr. Gassava, our close friend. We become friends now.
Mental health issue is in every household of the world. Everybody can have, we have already we are about. So being the case, we need to look at our laws and ways and means how to tackle it. Because it is not something that visiting us and leaving us. No, it's going to stay with us permanently. As we have from time to time malaria, from time to time we have diarrhea and things like that. And I was privileged to have study tours in Iran years ago. In Iran, they have a big central hospital where they treat all kind of illness in Tehran. But if you visit that hospital at times, you'll be surprised. You will find scientific doctors like our normal doctors, highly qualified. But you will find some people there also, spiritual doctors, doing prayers and the like. And you will find there also traditional doctors combined together, no matter how sick you are, they are able to take care of you. I visited some patients there. Some of them were born as bisexual. They were born naturally like that. And we read that in the Holy Quran. We read it in our Sharia books. At times it can happen. But they treated them, they guide them till they choose what they want to be, and they are helped scientifically to be that. But if you say it in the Gambia here, it's a crime because our knowledge is limited. Gambian knowledge, very seriously, it's limited. We don't travel a lot, we don't read a lot, and we want to talk a lot. That's our main problem. You see, if you go to Saudi, they imitated Iran, things like that, and now they have a big hospital in Riyadh as well, treating all kind of sickness using all methods and kinds. But why I requested to say something is because of Mr. Gassama, Dr. Gassama. In his speech, he discussed about somebody who is mentally ill and the father passed away. He have equal right to the inheritance of the father. But normally, we tend to forget those people. We don't count them. And the one with cancer or any other sickness is given his due. So really, that is not only abusing somebody's human right, but it's a violation and denial of the Holy Quran and the saying of the Almighty Allah subhanahu wa ta'ala. Of course, the Holy Quran guides us how to give those people their inheritance, their properties. He said, don't give it to them as you give to a healthy person, a sensible person. No, but keep his properties for him and see his basic needs to make him a human being, clothe him, shelter him, feed him, make sure he's clean, make sure his needs are met, because it is his own property, but not to kick him away. If it is necessary, invest his money to a business that will grow so that the money will never be like that. The Holy Quran hasn't left anything for us. It's very clear. It's only the problem that we don't read. Gambians are not having that culture of reading or research. So I want to say thank you very much to all of you, especially our commissioner. I always call him Commissioner Tanka Tanka. Because this issue for her is her life. He forced everybody in the commission. We cannot even breathe without we talk about something about this issue. And if you need something from her, you must come with a project of that place so that it will be easily approved. So thank you very much. Inshallah, God save us. Wassalam.
The last panel that I was listening to, it was an amazing panel. And it really spoke a lot about, and then when someone brought it together, what are the points, what are the follow-up points, it has covered almost everything that I wanted to say today. So I will be very brief to mention a few things about, because I'm UNICEF, I cannot leave a stage without talking about children. And I would be saying, which has been already mentioned, that we need to also understand the developmental sensitivity when it comes to mental health. So a child, and it's scientifically proven, the doctors who are here, unborn child, if the mother faces violence at home, mentally not satisfied or well, the child is born with mental disabilities or physical disabilities. So there is a manifestation from that embryonic period, right? So we need to really see that developmental, the life course approach. In addition to that, I think when we see domestic violence also, that has an implication on children. If you see a child not behaving well in school or with the friends, then you know that the child is experiencing something at home. So we need to really be careful about parenting, which did not come in the in the actions, but I think parental education is extremely important. Parents should and must understand the implications on the children, their children, of their acts. If they're violent, their children will pick up violent behaviors. So that is very, very important. The other thing is bullying. Bullying by the family members, by the friends, by the classmates, by whoever. And now, in the era of this AI and internet, even online bullying has an implication on mental health of everyone, be it children, young adults, everyone. So I think that it's very important. Now, I would like to mention just a few data that we need to consider. 46% of women aged 15 to 49 experienced either physical violence at least once since age 15. This is DHS data. While 26% ever married adolescent girls, 15 to 19, experienced physical, sexual, or emotional violence committed by their current or most recent spouse, while 6.3% adolescent girls have faced sexual violence. These are reported cases. There are many unreported cases. Dr. Dibba and myself, we were just whispering to each other, saying that we all go through mental health issues. Just the way we go through viral fever, we also go through. One day I'm well, one day I'm not well, one time I'm depressed, the other day I am happy. These are all emotional phases that we need to really acknowledge, and then we need to support each other. One of the speakers already mentioned about that. Gambia has legal instruments to protect the mental health and stability of women and girls. I will be emphasizing on girls and women because that is one, segment of the population who are not really paid much attention to. So, for example, Women's Act guarantees every woman the right to the highest standard of physical, but also mental and social well-being. And these are the tools that we must instrumentalize. And we must actually also stop some of the harmful practices. During the FGM pushback a few months back, a number of women spoke up about their experience while they went through FGM, and that is also a mental health issue. At the same time, about 50% or more than 50% girls aged 0 to 14 years, they have faced female genital mutilation, but also 1/3 of the adolescent girls are married off before the age of 18. And we have no idea, maybe because someone mentioned about research, there's a dearth of data. We don't know what those child brides are going through. Leaving their parents at the age of 14, 15, 16, going to a very possible aggressive environment where she's always being criticized and she's always being undermined. There will be definitely mental health issues that we are not talking about today, possibly. So someone already mentioned about the survivor or survivor-centric, GBV survivor-centric mental health support, and that's why psychosocial support is extremely important. A number of people yesterday and today spoke about KUSH, so I'm not talking about that, but again, going back to the parental education, because it is happening under our nose as parents. Now, what are we doing? And how are we communicating with our children to prevent? Someone also spoke about prevention of mental health issues. I think it's very important to have that dialogue and discussion. Quite often, and excuse me if I'm wrong, I mean, you might say that you are not a Gambian, how can you speak about that? But I'm a Bangladeshi, and I know patriarchal society, how it runs. Quite often, men do not really take the parental role actively, and they leave it on women. And what happens is quite often women are left with many children and they do not have time to pay attention to each of their. I have met girls, women, age 31, came to deliver the eighth child. So that the husband is a migrant worker. So of course the woman is going through something, and it is a form of mental health issue. Just to also mention that the national health strategy must accommodate, I think it already mentions, but must accommodate strongly the promotion and prevention activities by identifying the individual social and structural determinants of mental health. That's extremely important. And it's not only health, someone mentioned about education, and it is important that we bring mental health in the education policy, because there are a number of children with disabilities, children with different identities, many children who are not perceived maybe as normal. They're in school, and how do we cater the needs of them, treat them equally, because it is a human rights issue. And I think this entire symposium is all about how do we perceive, or how do we take mental health issue as a human rights issue. So I would not speak more about other things that I wanted to, but community-based mental health already came as a big point, and I think that's also the starting point. This is a wonderful initiative, and we must continue this dialogue, and we must continue in the mass media, because someone spoke about rural intervention. The rural people cannot come to ICC and participate in this beautiful discussion and dialogues. So it is important that we engage mass media, TV, radio, talk shows, local media, and speak about these issues to normalize mental health and start talking about it. I really would like to thank NHRC, ActionAid, WHO, and my UNICEF colleagues, and of course, Ministry of Health for taking this lead. This is really a big step forward for the nation. And we promise as UNICEF that we will be with you together in this journey. Thank you so much.
You like it to be informal. Thank you very much. We'll call on now. I just wanted to reiterate exactly. We started some radio programs. We started like 2 weeks before this session, and we're going to continue with others. But we're also going to push Ministry of Information to give us 2 slots on TV. So it's going to be a continuous process. And I'm thinking we have a mobile clinic within the NHRC we do. We'll make one of them a mental health thing. So we go to the rural areas and speak to the people. It's not something to be ashamed of. You don't have to wait until the person goes naked before you start shouting. You shout from the beginning when you see things that are not normal. Thank you very much. We'll call on Mr. Fafa Cham to say a few words on behalf of ActionAid.
I must say that I think I cannot spend the last 2 days in a better place. I cannot be engaged in a more meaningful discussion than the one we have in these past 2 days. We can never overemphasize the importance of this discussion. However, I want to just remind us that while we looked at or trying to address mental health issues, please let us not forget the structural causes. Many a time we attempt to solve problems, but we do overlook the structural causes. And if the structural causes are not addressed, it's going to be challenging to have the problem solved. Whilst we attempt to do it, Let's look at the inequalities that exist in homes, in communities, in offices, and so on and so forth. These inequalities create a lot of depressions for certain individuals that are disadvantaged in one way or the other. So it is important that we address them. Moreover, I would also want to appeal that it should not be like, yes, that's the end of the program, and we forget about it. We've talked about certain issues. At Oxenade, we are expecting that you will share with us the report, the action plans that we intend to do, and of course, we are looking forward to collaborate with the Human Rights Commission to ensure that some of these actions, something is done about it. What I want to emphasize is, let us not be buried after here. For those of your officers in NBR and in CRR, I think there is the opportunity to collaborate with our regional offices. In fact, something I know Kinte, of course. I remember when we were developing our plans, some of these issues came in. So I would urge that let the two institutions further strengthen this collaboration so that we can work towards improving mental health. Finally, we will definitely want to appreciate National Human Rights Council for coming up with this initiative. I don't know who is mom among you, but I know I received a lot of emails, a lot of calls. I'm not sure if she is here. But actually, we definitely appreciate, the follow-ups you make, because it makes us it keeps on reminding us what we should do. And on that note, thank you very much. We hope to have a more fruitful collaboration in the future.
When you spoke about MAM, it made me remember what Mr. Gassama said. That instead of deadline, we should talk about lifelines. So I will tell MAM, because she's fond of that. COB, 12 middays, COB, 1,400 hours. We're used to it. But before I give Ministry of Health to say a few words, let me really thank some particular, not the whole staff worked towards this, but I want to thank a few people who have really, like Mr. Cham said, Ma'am Deban Job, she's the Director of Communications. Then we had Basiru Ba, yeah, Director of Programs and Resource Mobilization.
Like I said yesterday, we as a ministry, we are glad that this has happened, because it has shown that now it's not just the Ministry of Health that is concerned about mental health issues. The stakeholders who are interested in mental health issues are coming out, and they are showing us that they are willing to work with us. We really appreciate everyone in the room. And like I said yesterday, let's do this for Gambia. Let's do this for all of us, right? The VP shared his personal experience here. Most of us are giving our time and dedication to this because of personal experiences or personal issues. We all have family who struggled with mental health issues, and it's been ages we shy away from talking about it, right? But now we are coming out of our shells because we see that we are not alone. So we're saying take this to the households, because now as a family, we've been struggling. We lost our parents' first child. He died, and it was related to mental health issues as well. So that's why both my sister, Commissioner Diba, and I, Vice, that's why she's also very much passionate about this. And we are glad that we are seeing many other Gambians who are coming out to do this with us. So we are doing this for our brother Lamin Diba and for every other Gambian. And like I took note of that, so usually it's the men. A lot of things are around women, saying women's rights, girls' rights. Men do tend to shy away from coming out to say, I am struggling, I need help. So I'll say, men, when you need help, seek for help. When you feel like crying, cry. Don't bottle up things. If you do, it takes a toll on you, and by the time your families realize, it's already too late, right? So again, Gambian men, do not keep quiet. A lot of things have been there saying women. I am a woman, yes, I agree, and we like it that way. But don't forget yourselves. In as much as society thinks that you should be strong people, no, you're just human beings. You have feelings. Express yourselves. Cry if you need to cry. Say, I am tired if you need to say, I am tired. Else, if you don't, you keep quiet about it, we will lose you, and we do not want to lose you, okay? Please do that for yourself. Yes. Back to what I've been tasked to do. Again, we are ready as a Ministry of Health to work with every stakeholder. Let's do this. Come join us. We are not taking anyone's responsibilities from them. We just want to say, let's come together, organize ourselves, and do this for country. So again, I thank everyone for being here and the energy you've all given to this. We really appreciate it. And we do not want to leave the conversation within the four corners of this room. And I'm glad that it came from many other people, not just us. Let's take it to our households. Let's take it to our VUs, our campus, and everywhere. Let's talk about it. Let's start making noise, and everyone who is struggling with mental health issues will feel comfortable to talk anywhere and seek for help. The help is available, but it's sort of hidden somewhere. And this was really enlightening for me. I learned a lot here, and it brought out a lot of things and a lot of perspectives for me. So again, I can't overemphasize thanking everyone. And
before you close, before you close, she will close. Right? It just occurred to me throughout this meeting. We did not tell you. I guess some of you know that we have offices, 2 offices that are opened in NBR and CRR, and we have the staff around. Like somebody said, he knows Kinte. Everybody knows Kinte, there and others. But also for the Ministry of Health staff who also came.
Yeah.
We also want to thank you. Okay? Thank you very much.
Yes. So the collaboration you are talking about, I was going to end with that. That the regional directors, I saw Mr. Balde here since yesterday, and some of our programs, the integration that is a concern to Mr. Gassama and the others. Yes, the integration has started within the Ministry of Health. Our programs are now doing a lot of things together. Traditional Medicine Unit is working with the National Leprosy TB program. They are working with the Malaria Control program. The Traditional Medicine Unit is working with even the orthopedic, the traditional bone setters. So we are doing a lot of things. And because we know that different service providers cannot work in silos, we need to come together. And of course, in the whole of this, psychosocial support is always needed. So we are doing this, and we are calling again. My call to action is, let's come together and do this for Gambians. Thank you. And on behalf of the senior management of the Ministry of Health, I want to declare this officially closed.